It's another Friday, and we're always excited about Friday because this gives us an opportunity to learn one or two more things about glaucoma. Welcome to Glaucoma on Radio here on Solid 100.9 FM. Of course, it's brought to you in collaboration with the Eye Specialist Hospital in Enugu, Nigeria. They're providing the technical assistance, and for weeks, it's been running. And some of you who have followed, I'm sure you're grateful for the quality of insights that you get every Friday. I'm excited to be with you today again as we continue our journey of creating awareness about glaucoma, which, by the way, is one of the leading causes of irreversible blindness all over the world. Today, we'll be focusing on a very important and often overlooked aspect. When glaucoma runs in the bloodline, now many people don't realize that glaucoma can be hereditary. If one person in the family has it, the chances are high for other relatives. But what does this really mean? How do we detect it early, and what preventive steps can we take to protect our sight and that of our loved ones? Of course, as usual, to help us unpack all of this, we have with us Dr. Suhanyo Keke, a consultant ophthalmologist. Good morning once again.
Good morning, UC, and good morning, dear listeners.
Okay. Like we always do, is like a tradition. We start by redefining or explaining what glaucoma is and why we often call it the silent thief of sight. You know, radio is such a thing that there are people who are listening for the very first time today. So let's bring them on board.
I agree with you. Yes. Before we start off, we all know we have been hearing this disease called glaucoma. Glaucoma is a blinding eye disease. Unlike many other eye conditions, it causes permanent damage. Any amount of vision that is lost cannot be brought back by any treatment modalities. At presentation, if you have lost 90%, that 90% is gone, and we cannot retrieve the 90%.
You stay with 10%.
So it is going to be 10% that we are working to preserve. And that 10%, even if you have 1%, it is not a bad thing at all. We struggle hard because the little you see is still very good for you to mobilize yourself, do some little activities of your daily living, which is very important. That gives you some sense of independence. So preservation of your vision at any point is very important. Now, glaucoma leads to irreversible blindness, and it is a silent thief of sight. Why do we call it the silent thief of sight? Because at early stages, if your eye is crying of pain, it is saying it is itching, it is tearing, you are not seeing well, you will surely run to the hospital or wherever the help is, because something is disturbing you. Now, this eye is quiet. It is not going to tell you that I'm not seeing. It is just staying with you, living with you very normally, and something is biting your sight off little by little.
No pain.
It is not even pickpocket. This is this is taking it right in front of you, within you, living with you with no tenancy, nothing. It is taking it out of you. That means something strange is happening, and you don't have the privilege of knowing what is happening to you. But so what do? You can just find a way of doing an eye check, periodic eye check. More so if you have a relative in your family, however distant. Your great grandmother died at the age of 106 of blindness, or somebody in the next 3 compounds, your lineage he was blind and not moving out. You may not really know what caused the blindness, because at certain level people might not actually know what caused it. Just know that there was someone blind. It may not necessarily mean that that person was blind from glaucoma, but it is a pointer. Something is not good about the eye of your family. I think the notion in this environment is that as you age, one can go blind. It is taken for granted. Mama is old, Papa was old, but he was, when he died, he was blind, but it came at old age. Blindness is not part of aging process. Yes, your vision can drop. It doesn't really mean you must go blind. Something must have triggered his blindness. So that in itself is a significant information for you to say, look, something is not right about my family. So it is good I go and see the eye doctors. It is just appropriate. After all, we all have habits of fleeting the houses, doing herbicide, pesticide. You must not see the snake before you apply the snake venom, because we know the snake is troublesome. We don't want the bite of a snake, as a matter of fact. So periodically you spray the, you call the fumigators and do the fumigation. Likewise, in your eye, something is stealing your sight. You
need to do something about it.
You have to be proactive. That is the take home. Be proactive and check your eyes. Nothing is too big. Gift of sight is too precious. It is taken for granted as long as you are seeing. The day you stop seeing, even to eat your food, you have to lift your body and go to the kitchen. It's not going to be easy. So prevent this situation from happening to you.
All right. One of the things we don't do in Africa so much is inquiry. Okay, so how strong is the hereditary link in glaucoma? If my parent or sibling has glaucoma or had glaucoma, some people don't even know whether they had, but we used if they were blind or they had some eye problems. What are my chances of developing it?
Yes, it's a very good question. If you have your mother, father, your sibling having blindness or glaucoma in the family, you are at a high risk of developing glaucoma. Usually the risk is put between 4 to 9 times higher chance than someone who never had a history of glaucoma or blindness in the family. Okay. That means you have a higher risk naturally, and in your lifetime risk of having glaucoma is about 22% in your own lifetime if you have a first degree relative. First degree relative means your mother, father, your siblings. These are all your immediate blood ties. These ties goes with a very high risk of developing glaucoma. So nearly, we can call it 4 to 9%. We can even put it at 10% risk of having a high chance of getting glaucoma, and in your lifetime 22% chance of getting glaucoma, as compared to someone who never had glaucoma. In his own lifetime risk of developing glaucoma because of other factors is 2.3%. So a lot of studies have been done on relatives of patients who have glaucoma, and it shows that there is a high risk of developing glaucoma amongst first degree relative. So now, when we say glaucoma is hereditary, what do we really mean? This word, it runs in the family, it runs hereditary. Sometimes we don't all understand what we are talking. Just know that as an individual, as a child is born, child is not an individual on his own. 50% of the child, the genes come from the father, 50% come from the mother. Now, these genes are like, it has some instruction manual. It's just like an instruction booklet. You buy a phone, it has an instruction booklet. So just like any device that has an instruction manual, nature made it that as human beings are created, there are some instruction manual laid down inside your body, and that is in form of genes, and these genes carry those instruction manuals, and they go into the child, and the child is born with it. For some reason, there is some faulty instruction. Okay, we call it mutations. So some genes that is involved in the optic nerve head regulation, anatomy of the optic nerve head, is now get deformed for some reason. It can be, you can have a genetic problem, but maybe some environmental factors, so many other things come in. It gets modified. Now you have a defective gene. So this defective gene will be passing an information that this nerve head is going to be thinned out. It doesn't have good blood flow. Some will even at some genes, like the myocilin gene, for instance, it triggers early onset glaucoma. So it's so some genes are responsible for certain types of glaucoma. There are different variations in glaucoma, and there are different variation in genes, and these genes get mutated, means they are abnormal. The instruction manual has a problem. The instruction that is passed down has a problem, and once the child inherits it, as the child grows and he has his own offspring, he is going to send it to his own own generation. So that is how the cycle keeps continuing. So it's good to know, because for now, if you have to really go and do a genetic test to know which gene is going to be complicated, there are millions of genes in the body, and it may not be possible for now. In time to come, I know technology is moving very fast, and so many things will come up. So, but for now, the easiest thing you can actually do is to go and get your eye checked. It doesn't even take 30-40 minutes, except you have a problem, then you have to dilate the eye, but it is all for your good. Just, I'm sure 1 hour of your time in a year is not too much for anybody.
I also understand that there are particular ethnic groups or demographics that are more at risk of these hereditary glaucoma.
Yes. The black race is particularly more prone to developing glaucoma. The primary open angle glaucoma is predominant in the African race, and it is one of the type of glaucoma that is hereditary. So yes, the black race is more predisposed to primary open angle glaucoma, while the East Asian race is more predisposed to angle closure glaucoma. But we limit for the open angle glaucoma. We also have the juvenile, there are different variants of the open angle glaucoma. You have the juvenile open angle glaucoma, which you see in young people from 3 years to 40 years of age. It is also very common in children that who have family history of glaucoma. So they tend to present early. And coming back to the issue of ethnic group, in Nigeria, for instance, the Igbo race is more implicated in having primary open angle glaucoma than any other race.
Is there any reason for that? Is there any reason for that?
We actually don't know a particular reason. A lot of studies are ongoing, but it shows that of all the all the races, the Igbos, Hausas, Yorubas, the Igbos are most susceptible to developing glaucoma. So it is with us. So even when you say my father, my mother, in my lineage I don't have anybody who is blind or who has glaucoma, be sure that you are still an Igbo man. You are still a black. So these are all factors we cannot deny ourselves.
I wish we know the reason, but we don't at the moment, and hopefully research will provide the reason in the coming years. Now, since glaucoma can run in families, one will want to know at what age should children or young adults from such families start screening?
Good question once again. Now, when you have a family who has relatives who have glaucoma or blindness, you start early. If you have a child who is of school age and going to school, there is a form that the school at least send you that you should check your child's eye. Don't forge it, which is a common habit here. It doesn't take anything. You can take all your children one day to the hospital, let them check all your findings. It is quite helpful. When you do it, you can pick one or two things, and many children who need eyeglasses, for instance, can be picked while doing a general screening. And if the doctor sees that there is a problem, he will tell you. He's not going to ask you to come every year because you are a child. At 3-4 years, you are not going to ask them. Maybe as the child grows, maybe 7-8 years, you will see if the risk is not looking significant, we will delay it. So at that age, just ensure that if there is a periodic examination you are supposed to do, go ahead and do the examination. If you have a school age child and the child is not seeing the board well for any reason, please ensure that that child is checked, because it is not only glaucoma that can blind you. Sometimes you have a healthy eye and you will still go look like a blind fellow because you did not do the needful at the right time, at the right place. So you just denied the eye the opportunity of seeing, because we refuse to give the glasses to the child at that age. So these things are very important. And then if you have your siblings in your family who has glaucoma or who is short-sighted, in recent time we have a lot of children who are short-sighted. Short-sighted means they are unable to see far distance. So because children are now doing more near work, so they just wear glasses all the time. Those children are actually at a higher risk of developing glaucoma. And when you have a sibling who has short-sightedness, you also check the other siblings for short-sightedness, because that one also runs in the family. So when you see one or two problems in your family, those siblings of glaucoma patients or relatives with siblings have about 4 to 9 times chance of developing glaucoma. So it is important that once you have a sibling with glaucoma who is a glaucoma suspect at whatever stage the disease is, bring the others for screening. It is sometimes parents are also afraid, what if the doctor tells that my son or daughter has glaucoma? This is like pronouncing a death sentence. Nobody wants to hear. But if you have come and the doctor has told you, it is a good time, because the chances of preserving your sight is higher, because early detection means you will be able to preserve the sight, you will be able to preserve the progression of the disease. So that is why early detection is important. Sometimes you also know that it is your eye pressure. You come to the doctor's clinic, when you are asked to read everything, you read. Everything is fine. You were able to read 6-6, meaning you read everything in that letter and in that chart. You go and check your eye pressure is equally normal. But it is when you take a look at the into the eye, the doctor now says your eye is suspicious. Sometimes you have what you call the normal tension glaucomas. Those normal tension glaucomas, they are glaucomas that occur at normal eye pressure. Normal eye pressure is between 10 and 21. So even an eye pressure of 8, you can still have glaucoma. So these are the normal tension glaucomas, and when the doctor has an identification, he examines and he thinks it is glaucoma, he is going to subject you to some test, and from the test he can conclude that either we take off for treatment, we observe, or he will still proceed with further tests, and depending on whatever his decision is, he is going to act on it, maybe set a target pressure and follow it up.
All right. Our people are not very big on checkups, and each time you talk about the 2 factors or more come up. One is awareness, the level of awareness. Those who have lost their sight right now are very serious about it, but it's almost late, or it's late, because knowledge should be applied at a certain time. Okay, so then you also talk about people complaining about cost. But then of course it doesn't cost arm and leg. I mean, it's something you can afford, at least. And then there's the superstition. There are those who think they can wish things away, and then when you mix superstition with religiosity, you get a concoction that is terrible. So some people believe that even if it's there, if I don't go to see a doctor, maybe
some miracle will happen.
So how do you address all of this? And then how often was the recommended frequency to seeing, getting your eyes checked? Especially now, there are those who don't even know, or they choose not to know that there is this thing in the line. All you just need to do is to ask yourself, my dad, my mom, and then my grandfather, what was their eyesight like? For those who met their grandfather, though, because some of us didn't. Okay, so let's look at all of these reasons, and then how often should I check my eyes?
Yes, you made some very beautiful points. This environment is filled with superstition and religiosity, as you put it. And when you cannot, this is not my portion. It cannot be my portion. And for those
I don't know whose portion is it supposed to be.
I wouldn't know either. For those that have it all the means, they want to run from Nigeria, from Enugu to Lagos to Abuja, because first you want to run and explore a solution first before you start traveling to India, UK, US, because that is where our help comes from. Most of the time we make it clear glaucoma will always remain glaucoma, and story will not change except if you have some technological guidance that is coming in, which is still possible. We don't foreclose anything, but within the scope of science, this is what is available. My take is, don't waste your time. Start doing the needful. Even if you want to seek a second opinion, that is fine. Nobody is stopping you from taking a second opinion, but don't delay the care that is immediate and available. Seek the care and ensure that you continue on the treatment while you go for other
Options.
other option. Now we even have more dangers. We address religion and the superstition. We now have Google and internet. Internet proffers solution to almost all the problem, including glaucoma. You take cucumber, place it on the eye, and it put the juice, and you will begin to see. Don't waste your money on doctors. It is waste of time, waste of energy. Patients believe all these shortcuts to treatment, and they keep going to all that. By the time you have glaucoma and you go and apply all those concussions you have put inside the eye, you now come with a corneal ulcer. Corneal ulcer means a wound inside the eye. By the time you come with that, where do we start? Your problem was in the back of the eye. Now you have brought a wound inside the eye. Your eye is bound to go bad. Please, internet is a good place to seek information, but you should be guided in the knowledge you are tapping there. You know that internet is garbage in, garbage out.
Yeah.
If you put a key in right things, you get very good and clear information. If your information is not clear and you are looking for shortcut, yes, internet can give you very pungent short answers to all the question, but you know it cannot work. Just ask question, is this option? You put honey and some other thing inside your eye, is it looking like a feasible option to retrieve your sight? Your common sense should guide you first.
And if you want to experiment, the eyes doesn't look like something you want to experiment. Even in Igbo, there's a way they say it. They say the jirifa eji abananti abananya. What it means that you don't use what you use for the ear to put in your eyes. It doesn't work that way. So the eyes, they're just too delicate, but poverty is a factor here. I had an interaction with a pastor who made a very revealing confession. He said that those who come to them sometimes come to them not because they believe that miracle will happen. It's just that they don't have money. So it made me begin to say, but then at least start with finding out what the problem is. I don't think there's anybody who cannot pay for at least a test. I mean, if you have to scrape up money, get the test. Let's know where you even stand. Okay, so if detected early, let's assume someone goes for this checkup and detects early. Now, I have a history. My family is implicated. Can that act prevent blindness?
Definitely yes. Yes, if you have a relative who is living with glaucoma, and you subject your relatives to glaucoma screening, and by some stroke anyone of the member is found a glaucoma suspect, a glaucoma individual, glaucoma patient, the chance of preserving the sight is very high, very, very high, provided you do the needful. Sometimes you also see that individual, we also see patients who come with their relatives, we take a look into their eye, you see that they even the son or daughter, the vision is almost gone. It also happens that way, especially people who come from very far-flung areas. We have such experiences also. That doesn't mean that it doesn't happen to those living around, but it is good to know if you come early and your doctor says you are suspicious, maybe you need to do some few tests, let's know where we are starting, then at least you will confirm this is your problem. Of the wide array of treatment that is available, you go for the one that is cost effective and affordable to you, and monitor. The little you can do is to monitor yourself. I also know a lot of patients who have lived with glaucoma for over 20, 30, 40 years, and they are doing well. They are still seeing. Even the little vision they have been able to maintain it. Yes, it is possible. So the prevention, you can prevent blindness if detected early. One, then you do the follow-up. Are you taking your medication? Are you following up with the care? Your regular checks after being diagnosed. These are all things that are important. If you can do all that, why not? We all need our sight till the last days of our life. So it is important.
All right. Just before we open up the talk lines, since we're talking about these things being in the line and this thing being a family issue, don't you think that the approach in saving people from glaucoma should also have a family leaning? That's to say, I mean, since it runs in the family, then it should be our family business. It shouldn't be, okay, it happens to me and then I'm reacting. Every family should do a background check to see how implicated they are. What are your thoughts on that?
You are right. We also go as far as calling family members to come for screening.
Check up, okay.
So sometimes it can be very painful. We come for family screening and we sit down, and if you make it a day affair, we tend to see more people coming. When you make this window open for maybe every I did it for 3 whole months, and I did not, there are Saturdays, there are days I did not see more than 1 or 2%. So it can be very frustrating. But when we make it a one-day affair, people tend to clog up and do it.
Yeah, because they know the opportunity will be passed.
So it is important to take opportunities when they present to you. If you hear there is glaucoma screening, avail yourself. Maybe that screening day, most of the time you don't spend your monies. You come, you queue up, and you get your eyes checked. If that is what you like, fine, get it done. There are always screening, 2, 3 times in a year. Look out for it. And then we also have very peculiar situation. Some family members who have this condition called glaucoma or blindness, they don't let the members of their family know that they are having this condition. It is very important to express yourself, reveal your situation to others, so that your loved one, your children, your sibling, they will not pass through the trauma you have passed through. Living with blindness is a very difficult, trying time for you as a person, for the members of the family. So it is very important to engage your family members, whether it is your children, any of them, during your gatherings like Christmas. Just it is nothing bad. It is not that you have a spiritual attack anywhere. It is a natural problem. You can have a problem that you are born with. After all, people have hypertension, diabetes. So it is the same way. It is nothing abnormal about it. You let others know, so that the others who heard it, you are not sending them to hospital. At least the others owe themselves a responsibility to go to the doctor and at least take a look at their eye. That is the simple truth.
Okay, and you don't need to wait for free checkups before you can check your eyes. It's important. If your eyes are dependent on those free checkups, I mean, that means you're actually gambling. Yeah, you're gambling. We should love ourselves enough to say, let me bring out 5K, 6K, as the case may be, and do this checkup. You know the condition, and then you can take it from there. Welcome back. It's still the Glaucoma Awareness Program on Solid 100.9 FM. A lot of awareness have been created this morning. If you have a question, please let's get your questions as quickly as we can. We have less than 18 minutes to go. 0909 771 1009, 0902 Let's get your consents, and it's important we ask questions. The conversation has been around the fact that glaucoma is hereditary. You can also call 0704 550 2840. Hello, good morning.
Good morning.
Hello?
Good morning, UCDMC.
Yeah, good morning,
I'm
Osman.
just in the studio. Is Osman, the chemist are calling.
You're welcome. Go ahead.
I'm calling to thank you for immensely for putting up this glaucoma awareness program, because this program is a celebration of hidden knowledge that many people are ignorant of over the years. So it's a nice program that will happen a lot. But there are questions I have, and I will direct the questions to doctor in the studio.
Go
So
ahead.
the question number one, I would like the doctor to repeat the normal range for eye pressure. The second question is that what is the unit for the measurement of this eye pressure? Is this in atmospheric ATM listen permit?
Hello? Okay. Keep the calls coming. You can answer him.
Yeah, the normal eye pressure is between 10 and 21 millimeters of mercury. Millimeters of mercury is the unit of measurement, but just know that even when you have a normal eye pressure of 10 or 11, 12, 13, even at 8, 9, glaucoma can be there. That is called normal tension glaucoma. So having a normal eye pressure does not set you free from glaucoma.
Okay, keep the calls coming. 0909 771. Hello, good morning.
Good morning.
Yeah, good morning. What's the name?
My name is Rose. I'm calling from Enugu.
Okay, go ahead.
You say I want to ask two questions. One is my personal question. The other one is the general one.
Go ahead.
Let me off my radio.
Hello?
So I'm hearing. I want to off my radio.
Go ahead.
My question is, I have lost my both eyes.
You-
glaucoma.
You've lost it
My
already?
question is, yes, years back.
Okay.
My question is for the doctor. Is there any need to add putting eye drop in my eye?
Okay.
Because I have lost the eye. I went to Pakistan for another health challenge. So the doctor there, I wanted to see, notice that I was being led, but I was nothing. So he continued to press me to go and see the eye clinic. I told her that I have lost my eyes. There was no need. She continued to press me until I went. So I started. So since that time, they have been recommending eye drop, and they have been putting eye drop.
Okay.
So I'm listening. I don't have more money for that. Now, is there any need? I didn't know I didn't eye drop. That's my personal question. Then the other question is, for a person to go and do some check, does this require the person to declare that he wants to check, or does this mean that anybody who comes for any eye problem, the person will be checked?
Did you get this question? Thank you, sir, for calling in. You could have just listened and not do anything, but at least you called in, and we appreciate that. Go ahead.
Okay, thank you for those questions. First, so sorry that you have lost your sight. Now, you surely need to be on the eye drops, because even when you have lost your sight, the eye is still part of your body, part of your human being, yourself. So it keeps creating high eye pressure, and when there is high eye pressure, you can have pain, redness, tearing, headache, very painful headache, such that you may not be able to bear it if you don't do anything about it. At that point, the the intervention may have to be very grave. So it is better you are on the drugs. The doctor did the right thing and you are doing the right thing, taking the drugs. Now, the next question is, if someone has an eye problem, yes, if you come with an eye problem to an eye hospital, then the eye doctor will do a thorough check. No eye doctor will do a half and half check, except you go to optical shops. Optical shops are shops that deal with prescribing glasses. They may not do more than that. Some do, some bigger ones may do some work, but most small ones, they might just check you for glasses and give you the glasses. So it is better you choose where you are going to go to the right places where you have eye doctors, so that you have the right information.
Okay. We can take a few more calls, maybe one or two. 0909-771-1009 or 0902-311-1009. You can also call 0704-550-2840. Ask your questions, and you can share your experiences. And as the man was calling, I was imagining how he's coping. While I'm not trying to pity him, but my heart goes out. Is it not possible that it would have been prevented if it was detected early?
It would have been prevented if detected early, but you don't know the stage in which he actually presented to Parkland, because we keep seeing patients who come very late with two eyes gone blind. After 5-10 years, they actually present to the hospital, not even with 1% remaining. At this point, I want to still enlighten our listeners that Igbo race is a risk factor. The studies done in Nigeria shows that Igbos are about 7.7% at risk of developing, more at risk of developing glaucoma than any other race. And being an Igbo is an independent risk factor for developing glaucoma blindness.
Let's take this call. Hello?
Yeah, I just called back. I called back.
Okay, go ahead.
I started this. I started very, very early. So I think that the people I met, I was going to government health facility. I think that the people I met, I don't know what they did, because I started very, very early. They identified it that it was glaucoma, and they were treating me, but there was no education. They just examine I give me the drug, I go and start applying the drug. But since I came to Enugu, I'm a new person in Enugu here. Since I came to Enugu, when I started attending the health clinic, there was a lot of education which I didn't have when I initially started.
Okay.
They were just giving me a drug that I was applying, but there was no education. But here I have a lot of education. If it was in Enugu, I don't think I would lose my time.
Okay.
Because all the things they taught me here, if I applied them, I don't think I could have lost my time. So I started in time, but the doctors who I met from government facilities, they didn't treat my case well.
Let me ask, is there any trace of glaucoma in your lineage before you?
Yes, my mother had it.
Okay, so is there anything you're doing for those after you, like your children, so that theirs will not be like yours?
I draw it in their ears every time. You know, all these people, the way they behave, I don't understand. I tell them, the condition I have now, they cannot endure it.
Okay.
I continue to tell them. So if any of them don't take care of themselves, it's their fault, not mine.
So how are you coping?
I will not there. Anything I do now, I will be led by you. I cannot do anything on my own.
You still have a wife?
I lost my wife 2021.
So who's taking care of you?
I just have a little girl who is around.
All right. Thank you for sharing your experience. Let me take my last call. Hello, good morning. Hello.
Hello.
Yeah, good morning.
Good morning. I'm
Ogo Simba, good to have you. You people wait until we have few minutes before you start calling in. Go
I
ahead.
wanted to call earlier, but you didn't know.
Okay, go ahead. Make it quick. We're running out of time.
Okay. A little boy of about 4 years had glaucoma from birth.
From birth.
Yes, from birth, yes. The parents tried, but the thing later came cancerous, and it has killed the boy.
Wow.
Before the age of 5.
Before the age of... It's unfortunate.
Very, very unfortunate.
Thank you. Gosimba, how are you doing?
I'm doing fine. I'm fine. Myself.
It's in your voice. You're a very strong person. Yeah. Even though I know that some strong people also cry. Okay, we have just 2 minutes. You were saying something. You finish up and then closing remarks.
Okay, I wanted
The
to
Igbo
emphasize
race.
the Igbo race is at a higher risk than the other races in Nigeria, about 7.7% at high risk than the other race. And then Igbos, when they have glaucoma, they have a higher risk of developing glaucoma blindness. So the Igbos are meant to be more proactive in their eye checks. I know it is not easy to dedicate it goes with some cost. That is why it is not easy to be proactive. But I think we all make budgets for our feeding. We can't sacrifice 1 or 2 day meal and decide to do eye check, because the month you go blind, poverty is in front of you. That is the fact. And your independence goes.
And the moment you go blind, you have all the time.
Yes, the
You now have all
worst
the
thing
time.
that can happen to you is you lose your independence, and that is a setback in your life. And if you are very concerned about your independence, make your eye check a priority. With your eye, you can still move. Without your eye, you need a help.
All right. Thank you, Dr. Sohanyo KK. Thank you so much for the insights and expert counsel. I'm sure you got something. And like I said, if it is hereditary, that means we should attack it from a family point of view. And until next Friday, when we'll bring you another edition of Glaucoma Awareness, thank you so much. And thanks to the Eye Specialist Hospital for what they do. And do have a beautiful weekend.